When you look at health policy, there's kind of three areas that they look to cover: affordability, access, which is how do we access care, and then, of course, quality. And the Affordable Care Act was really set out to approach the access issue of helping people get coverage. But despite the gains made by the Affordable Care Act, many Americans still struggle to afford health insurance and struggle to find access to care. This is likely to remain a major issue as the cost of health care continues to rise. One of the reasons this may be the case is because there are federalized health insurance standards under the law, and the insurance companies have been raising the out-of-pocket maximums as they can each year, as it's written into the law, and they're also having network restrictions. So while many people are able to get insurance, they're finding that some of their coverage is out of network, for example. So this is something that they're going to continue to have to pay attention to. And access is also a big deal because we're nearing 10 years of the Affordable Care Act's coverage provisions being in place. Now, the law was passed in 2010, but most of the provisions for like the health insurance exchanges and stuff like that did not go into place until 2014. So we're nearly 10 years away. It's impossible to actually compare the numbers that we were told were going to be covered under the new law with what actually happened. One of the reasons is the Medicaid expansion, and another reason is because through the American Rescue Plan, they expanded and now made it even more of an expansion, the Affordable Care Act's subsidies, because many people were priced out of their policies due to their income. Maybe a family of four making $88,000 would not have received much help under the original law, but by the expansion of the Affordable Care Act's coverage provisions, those individuals are finding that they're going to get quite a bit of relief now. And so we're going to have to wait and see how many more people go over to those policies. With regards to the aging population, as the baby boomer generation continues to rise and life expectancy continues to increase, you can expect to see the demand for healthcare services continue to increase as well, and the costs associated with that. One of the things that I'd like to also point out to you is the fact that as more and more people are turning 65, we're kind of at the height of the baby boomer population. Many of them are not as healthy as they were generations ago. Chronic disease management, therefore, number three, that I'm going to talk about, covers this. Chronic diseases include things like heart disease, cancer, diabetes, and they're major costs in the overall, major contributors to costs in the healthcare system. More and more Americans are retiring. They have comorbidities like obesity in the past, and so therefore they're going to be more likely to utilize the healthcare system and drive up costs. Number four, workforce shortages. We've been talking about the challenges of workforce shortages for years on our show, America's Healthcare Challenge, which if you're just now seeing it, thanks for joining us. Please check us out. We're going to be posting more and more on YouTube now as well, but we've got over 700 segments on our SoundCloud page. But healthcare workforce, before the COVID pandemic, we were already facing a workforce, and now we're facing a burned out workforce where more and more individuals in the healthcare workforce want to leave. So this is going to be a problem, especially in rural and urban underserved areas. Drug costs. Many people like to talk about the Super Bowl commercials. Have you ever noticed other commercials that are pharmaceutical commercials seem to dominate a lot of other games? And prescription drugs continue to be a major issue. Many Americans are struggling to afford their medications that they need to manage their health, seniors included. The Inflation Reduction Act in a couple of years will add some more protections for seniors struggling to afford their medications, which we will be reporting on here shortly as we are finishing up our research on that very important law. Next, mental health. Mental health is becoming increasingly recognized as a public health issue, and rightfully so. For years, there's, and by years I mean the last couple of years, there's been a growing demand for mental health services, and this has been exacerbated by the COVID-19 pandemic. We're really seeing this as a problem for the younger generation. And fortunately, though, we are able to be a little bit more open and talk about these issues. But I am hoping that there will continue to be more efforts put towards addressing mental health and giving people options to deal with this very serious health challenge. Finally, technology and innovation. What can I say about that? We have seen an explosion of healthcare technology over the last decade, and artificial intelligence, machine learning, things like that have been issues we have discussed for the nearly 5 years here on the program, and we're going to continue to see more of this being a big issue. I'd like to share a story today because we've been talking about how robots are helping do a lot of different things. And it turns out when my mom went to get her prescription, she noticed that she was a few pills short. That's because she was finishing up a prescription that was not full time. It was an acute issue, but she still needed like 3 or 4 pills. Well, she was informed by the pharmacists that they need to check. They're going to continue to check things manually because the robot made a mistake. So that's just one example of the issues that we're going to be paying attention to. Robots taking care of you and your health? Who knows? I already think that it's going to be robots selling to robots here on the internet here shortly. So you might want to get a robot to do your online shopping. Just something to consider. But hey, if you'd like to learn more, please consider subscribing to this channel. These are the biggest issues that I'm paying attention to for 2023 and beyond. But it's also important for you to know that the healthcare landscape is constantly changing, and there's probably going to be something new coming down very, very shortly. Please consider checking out my book, Retirement Healthcare Secrets. It's available on Amazon, or follow this page if you'd like more tips, questions, and always feel free to message me and share with friends if they have any questions about any of these issues or other issues in the healthcare industry. Have a good day, everybody.